Welcome back. Dr. Larry Stroud is with us, Mini Dental Implant Center of Louisville. Dr. Stroud has done thousands of these cases. Certainly he's the expert in the area when it comes to this kind of procedure. And believe me, less invasive, no cutting of the gums, you're wide awake and you're looking good just like Iris. You know, we saw the before and after pictures of Iris. Okay, I would think Iris is pretty happy. I mean, you have changed her life significantly. You told the story of she didn't want to go on a cruise with her daughter. She didn't like going to family reunion. She was embarrassed, no self-confidence. So after she saw the finished product and with her teeth, her brand new teeth, and they just look like real teeth. So I mean, what'd she say? What was the reaction? How did she feel?
Well, you know, she at first was just kind of dumbfounded, and I handed him a mirror after we put the teeth in, and she's looking at her teeth, and then she's feeling around in her mouth, and I say, "Now feel around up there with your tongue." And it's, you know, she feels around up there, and there's nothing up there. There's nothing in the roof of her mouth. There's nothing there. It's just she just sees her teeth there, you know. And so she got a little teary-eyed and gave me a hug.
Wow, that's a whole new beginning.
Yeah.
Now, you were telling me prior to going to New York and learning how to do this properly from the guy who actually really created the procedure, before you did all that, you were a general dentist, and you were telling me, you said you didn't get a lot of hugs when people have root canals. You know, I've had a couple of root canals. I've had two, actually. Yeah. And yeah, I'm not hugging anyone when I'm done with there. I just want to go home.
Yeah, I was a general dentist for a lot of years doing all that stuff and doing root canals and all that stuff. And get a lot more hugs doing this stuff than doing root canals, that's for sure.
And speaking of, when I say root canal, you know, I had an injury in the back jaw. Make a long story short, had this root canal. Now, some folks out there may have had an accident, and perhaps they lost a tooth or two. Maybe they have those bridges, a lot of wires and everything.
Partials, yeah.
Yeah, partials. Okay. Can you help folks with mini dental
implants? Yeah, I mean, a lot of people
implants?
come to me, you know, this case here is showing a person that you know, didn't have any teeth and lost her teeth, like ours. But a lot of people come to me, they're maybe just missing one tooth or two teeth. Or maybe they wear a partial plate that replaces some of the back teeth, you know, and those partial plates, people hate them, the wires and all those sort of things that hook on the teeth and get food under them all the time, and you know, have a whole garbage can full of those partial plates people brought in, and we get rid of those things and just give them teeth that stay in. It's really quick and pretty easy to just like replace a tooth or two, you know, and we do that a lot too.
And Dr. Stroud, I want to talk about some of your typical patients. Do you see folks who perhaps discoloration of teeth, maybe due to, it could be, I guess, chemotherapy? I would think also people, maybe a softball accident, weekend warrior, had something happen to them, or people who just had teeth that they've just had a hard time with, they've taken care of them, but they just didn't feel comfortable with them, that kind of
Well,
case?
you know, all those things that you're saying and even more. There's so many different reasons that people have lost teeth. You know, whether it's accident, horrible decay, a lot of times they've just inherited a bad decay problem in their family that their mom or dad had, gum disease like their mom or dad had, and they lose their teeth from that, the gums, you know, recede, the teeth get loose, all kinds of stuff that people lose teeth from. And you know, and then they get to a point where they're embarrassed, their smile is bad, or they hate wearing those plates in their mouth. So I mean, all those kind of situations that you see are all candidates for this. Really, anybody that's missing any teeth at all or frustrated with their smile is really a candidate for this. You know, like I think I've said before, we've done this for on ages 15 to 95. So, you know, just all sorts of people and all sorts of situations, you know.
All right, well, let's go to the phones. David is with us now. David, good afternoon. Welcome to the show.
Yeah.
Go ahead, David.
I have a question for Dr. Stroud.
Okay.
I have seizures, and I have at least one a month, sometimes two, and very rarely three a month. And people that are around me when I have my seizures say that I grit my teeth really hard, and sometimes I bit my tongue almost in two.
Huh.
And I was just wondering if those teeth that he's showing with the implants and putting the teeth in, I was wondering if those teeth would be okay for me or not.
That's an interesting question, Dave. I've never had that come up, or never really thought about that, or never been asked that before. You know, I'd kind of have to think about that. I mean, if you had teeth in, what do you have now?
Just my teeth, you know, my adult teeth. I'm missing one.
Just missing one tooth?
Yeah.
Okay.
Yes.
Well, then, I don't know if you really need me, except for maybe to replace your one tooth or something, which probably doesn't change the situation much at all from what you have now. I understand it can be kind of tough with the seizures.
Yeah, so a lot of times after I have the seizures, they say I grip my teeth really hard when I'm in the
Yeah,
seizure
you're
mode.
clenching your teeth or clamping your teeth together.
And I'll have like 5 or 6 teeth I cannot touch with a toothbrush for a couple of days.
Is that right? Yeah. Wow. I understand how that is. Now, for instance, I'm not sure what you're asking me exactly, but for instance, if you wanted to have your one tooth replaced, I don't think that would be an issue or a problem, because we purposely try to fix that to where a replacement or an implant tooth is not going to be hitting quite as hard as your natural teeth, you know. So you're not going to be putting undue pressure on it if you were to have a tooth put in. I think it would still be okay.
Okay, yeah, I'm not really worried about that one tooth that's missing. That's been gone since about 1990. I've been into some buckshot.
You're just wondering if you had to replace all your teeth?
Yes, because they're really giving me problems.
Okay. Yeah. Well, again, once you have new teeth in and the implant's holding them in, you know, when you go into a seizure, it's hard to predict what you're going to do. You know, so you probably are still going to clench those teeth together, and it will be okay. It'll still be okay with the teeth, but you'll probably still do the same things.
Okay. All right. Thank you
That's a
for
good
the call.
question.
Hopefully we answered that question for you. Thank you for the call, David. Raymond is with us now. Raymond, welcome to the show. You have Dr. Larry Stroud.
How you doing today, Doc?
Hello.
Doc, I got 2 teeth in the top of my mouth and about 6 stubs, and I got about 2 or 3 spaces in the bottom of my mouth. Am I a candidate?
Well, so you only have a few teeth left, and a few of them are gone, and there's just roots there. Is that right?
Yeah.
Yeah. Yeah. Sure you are. I see people in your situation, you know, all the time. It sounds like most likely those teeth that are left are bad. They're just going to have to go, and then we get you in dentures temporarily. You heal up some, then we put the implants in, and then then your teeth are just staying in. But you know, you're the kind of person, what you're describing is the kind of person that I see every day. You know, they've got bad teeth or whatever teeth they have left are really bad shape. A lot of times they're just sort of rotted off at the gum line, or you know, in really bad shape, and we just have to be rid of those things, and then move you on to the point where your teeth just stay in when we do the implants. Sure.
Thank you for the call, Raymond. Appreciate that. All right, your calls are welcome. If you have a loved one, or perhaps yourself, you're having a little bit of problems with your smile, maybe it's confidence, foods you love, give us a call. Dr. Larry Stroud is here. Mini Dental Implant Center of Louisville. 571-5263 is our number, but call his office for an appointment today. Free consultation. We'll be right back and tell you how you can win a golden ticket, and we'll talk to Dr. Larry Stroud. It's the Wednesday edition of Wave 3 Listens Live.